Hello and welcome back to GP Video Podcast by Nadia. So today we will continue talking about polycystic ovary syndrome. So yesterday I told you that there are three main criteria for diagnosing polycystic ovarian syndrome, and any woman who fulfills any two of them will be diagnosed as polycystic ovarian syndrome. Number one is menstrual disturbances. And two kinds of disturbances, any one of them should be okay. So one is regularity. Either the cycles are less than 21 days or more than 35 days, and then comes the amount of menstruation, either no menstruation at all, like you can go amenorrheic, or very very little, scanty, or menorrhagia, heavy bleeding. So any of these spectrums in terms of menstrual cycles. So menstrual disturbance. Number two is clinical or biochemical hyperandrogenism, which means the clinical features of hyperandrogenism are acne, hirsutism, acne not that important, but hirsutism, which is hair on your face, and then alopecia or male pattern balding. Or if not clinical, then biochemical, which is free testosterone levels, and if they are high, it means that this is biochemical hyperandrogenism. Number three is polycystic appearance of ovaries on ultrasound scan. So we've got two ovaries, one of them showing, or both of them showing 20 follicles or more, 20 antral follicles or more, or measuring, either one of them or both of them, measuring more than 10 cc is the diagnostic feature. Usually this ultrasound scan is done in the first half of menstrual cycle and not the second half. So that's that. And there is another test which is nowadays available and can be a part of diagnostic criteria maybe quite soon. Is called AMH, anti-Mullerian hormone. This is a very important hormone that is measured when a woman is being assessed for subfertility or infertility. So in case of polycystic ovary syndrome, AMH is usually high in quantity. So AMH can also become one of the standards, but not right now. The other additional features and very important features of PCOS are obesity, insulin resistance, and subfertility. And then because of all of that, there are mental health features as well, like depression, anxiety, because of, all of these kind of disturbances. So three main disturbances: menstrual disturbances, hyperandrogenism, and then obesity, insulin resistance, and eventually type 2 diabetes and subfertility. These are the features of polycystic ovarian syndrome, which is a cluster of all the symptoms that affect multiple parts or multiple systems of the body. Okay. Then approach to treating polycystic ovary syndrome. Now, there is not one drug that is gonna, alleviate all these symptoms. That's not the case. So treatment of polycystic ovary syndrome aims to address the symptoms and long-term health risks arising from abnormal follicular development and ovarian hormone synthesis, while taking account of the individual's goals for treatment. So what we'll do basically is we'll actually treat the symptoms basically, and the pathogenesis of this polycystic ovarian syndrome is abnormal follicular development, as I said, more than 20 follicles at a time in the ovary, and ovarian hormone synthesis, which causes all of these issues that we are talking about. And what are the ovarian hormones? Ovarian hormones are estrogen and progesterone basically. So consequences of anovulatory menstrual cycles are irregular menstrual cycles, then a lack of progesterone-induced endometrial shedding, which leads to proliferation of the endometrium and increased risk of endometrial cancer and subfertility. And then consequences of excess ovarian androgen production. So not only progesterone and estrogen are low, androgens become high, which is the male hormones, and that causes hirsutism, acne, and androgenic alopecia. Then obesity, insulin resistance, poor mental health. Okay, so number one treatment that can be done for alleviating the symptoms and trying to give adequate amounts of hormones to the body is putting a female on OCP, combined oral contraceptive medication. So that is number one. So combined oral contraceptive pill is number one. Number two is metformin. So metformin improves glucose metabolism by decreasing glucose production in the liver and increasing glucose uptake in tissues. So this is very, very important for a few things, for stopping the patient to become more and more insulin resistant and eventually type 2 diabetic. So metformin plays a very important role there. And also it is good for subfertility in an individual with irregular menstrual cycles, and also it's good for weight loss. A body mass index greater than 25 kg per meter square, metformin does not cause significant weight loss but may prevent weight gain. So you might not lose any weight with metformin, but it will prevent weight gain, and it will also make your tissues more sensitive to insulin, and then the glucose is all taken in. This is how it is, and it also increases the glucose production, decreases the glucose production in the liver. So liver is not producing extra glucose, and then the glucose which is in the blood is taken up by the tissue. So that's what metformin does. That's how it works. So it will stop you from becoming more and more insulin resistant and eventually type 2 diabetic, and it will also prevents you from putting up more weight. So number one was combined oral contraceptive pill for giving you adequate amounts of estrogen and progesterone. Number two is metformin for stopping you from becoming more insulin resistant and type 2 diabetic, and from stopping the weight gain. And then number three is weight loss medications. So weight loss medications, like as I've already spoken to you about semaglutide or tirzepatide or liraglutide. So either daily injections or the weekly injections that we have already, they play a very important role in weight loss, and in like metformin, stopping you from becoming insulin resistant or type 2 diabetic. So these are the three mainstay treatment for symptomatic relief for polycystic ovary syndrome. And apart from that, okay, I would like to just read this for you. For combined oral contraceptives provide the most effective menstrual regulation. They also provide effective contraception. So with that, contraception is also achieved, and they have the added benefit of suppressing ovarian androgen production. So combined oral contraceptive pills will also stop from the ovaries from producing male hormones, which can be beneficial for hirsutism, acne, and alopecia. Although some small studies of COCs have shown adverse effects on glucose metabolism, but then we have metformin and the other injections there to help that. So combined oral contraceptives provide the most effective menstrual regulation and PCOS. I'll talk to you more about it, but we've spoken about three things. Remember, metformin, combined oral contraceptive pills, and weight loss injections are very, very, very important in polycystic ovarian syndrome.